Hi, I'm Derek Dubay, the Director of the Transplant Program at the Medical University of South Carolina, MUSC, in Charleston. I want to thank you for volunteering to be a part of our study. We know that most dialysis patients are presented the option of kidney transplant right when they begin dialysis. And up to half of these patients are overwhelmed and do not pursue transplant, eventually becoming accustomed to dialysis being a part of their everyday life. If this sounds familiar, this video is for you. This 10-minute video describes the process of being evaluated for kidney transplant and being placed on the kidney transplant wait list from the perspective of a transplant recipient. While the transplant workup process is similar across institutions, our presentation is specific to MUSC. Thank you for your attention.
That's right. It's as simple as that. A kidney transplant can save your life. Listen, there is no doubt that dialysis is better than the alternative. Dialysis is a long-proven, life-saving treatment for end-stage kidney disease. It definitely has its advantages. Dialysis keeps you alive. But for those patients with kidney failure who are otherwise healthy, kidney transplantation gives them the chance to live a longer and broader life, free of the limitations that come with life-saving dialysis. Hi, I'm Everett German. I had a kidney transplant back in 2011. Receiving a kidney transplant restored my lifestyle, like it was before my kidneys failed. After receiving a kidney transplant, I again could be the husband and father that I wanted to be. Personal benefits aside, there are also survival benefits to be considered. Let's take a look at some of them now. To start, take 100 dialysis patients that continue on their weekly course of dialysis. 1 year later, 80 of the 100 patients on dialysis will be receiving weekly treatments. 20 of them, sadly, will no longer be with us. Of the 100 dialysis patients who undergo a kidney transplant, 97 of them will be alive. Keep going. 5 years later, 35 dialysis patients will still be receiving treatment. Out of the 100 transplant patients that started 5 years ago, 75 will be alive. Now, 10 years out, 10 years on dialysis, 12 of the original 100 patients will still receive weekly treatments. 50 of the transplant patients that received a new kidney will be living a normal life. Now, I was there. I had kidney failure. I had to face the future of being stuck 3 times a week with huge needles, sacrificing the time needed for dialysis and subsequent recovery 3 days a week. I was scared, but I decided to take control, take an active role in finding a solution to my disease. I am glad that I overcame my fear and was evaluated for a kidney transplant. Now, in my case, I sought out a living donor, a person close to me who was willing to donate one of their kidneys. Now, what about you? What do you need to go through to get a new kidney, to get your life back? At MUSC, they follow all the guidelines and requirements for kidney transplantation, outlined by the United Network of Organ Sharing, the agency that oversees getting, distributing, and transplanting organs, including kidneys. After you are referred to a transplant center by your kidney doctor, which is the first step in the process, that center will contact you and set up an appointment to be evaluated to receive the new kidney. Now you ask, what happens after you make this appointment? At most centers, including MUSC, there's a 5-step process for obtaining your new kidney. Following the referral comes the second step, the initial medical evaluation. Third is the completion of your medical testing, what I kind of call your homework. Fourth, a group of transplant specialists look all over your lab test results and your health history to see if you are ready for a new kidney. And if so, you are placed on the kidney transplant wait list. And then finally, the kidney transplant itself happens. Now let's take a look at each of these steps. First, the transplant center calls you and they set up a full day schedule for you to start the evaluation process. During this full day, you start by viewing an educational video that explains the process of kidney transplant. You then meet your transplant team, a group of medical experts that are dedicated to helping you get the best care possible and to make sure that you know all you need to know about getting your new kidney. At the end of these appointments, you will get a list of testing that needs to be completed before you can have your case presented at the Kidney Selection Committee. I call this list your homework. Now, this homework may include additional blood work, gathering outside records, heart testing, health maintenance testing such as a colonoscopy, and possibly a few other special medical tests and evaluations by medical specialists. Now, the homework that can be completed with the help of your family doctor, the local kidney doctor, at your dialysis center, or one of the MUSC telemedicine centers. It is very important to complete the homework in a timely fashion. The representative who provided this video works at the local telemedicine satellite clinic nearest you and can provide you with more information about the homework test. The faster that you get those additional tests done and the results sent to the transplant center, the quicker you can be considered for the transplant. You can expect completing this homework list. It takes about 1 to 4 months, and at MUSC, you are required to complete the homework list within 6 months. Once everything is completed, your records will be evaluated by the Kidney Selection Committee. Now, the Transplant Selection Committee follows national requirements and guidelines to determine if you are suitable for receiving a new kidney. The committee is made up of professionals from all medical areas related to kidney transplant. The experts will review your lab tests, they will check with other doctors and nurses familiar with your evaluation, and then they will see to make sure that you have the financial and social support network necessary to help with your surgery. There are certain conditions that you may have that will prevent you from getting a new kidney. The doctors and nurses will look over your health records and determine if you have any of these conditions, such as active or recently treated cancer, chronic illness that could lead to death within a few years, dementia, poorly controlled mental illness, severe obesity, inability to remember to take medications, current drug or alcohol abuse, history of poor compliance, limited or no health insurance. There are some baseline requirements all candidates must have, including a caregiver, transportation to and from the transplant center, and adequate medication coverage for transplant medications. Once you meet all of these requirements of transplantation, the selection committee will place your name on a national registry of waitlisted patients. At this point, all that's left for you is to await the phone call from the transplant center for that new kidney that has been matched to you. You must be available by phone and be ready to go for the surgery when the center calls. Across the country, the average time for a patient to be on the wait list for a kidney from a deceased donor is 5 years. At MUSC, the average wait time is 3 years. But every person's situation is different, so your waiting time to get that new kidney may take longer. Every year, there are more and more people suffering from bad kidneys, and since there are more and more patients in need of a new kidney than there are people willing to donate a kidney, it can become a challenge to get a kidney. Just a few years ago, there were over 9,000 dialysis patients in South Carolina. In this pie chart, we see that in 2016, there were over 11,000 South Carolina residents on the dialysis. Of those, just over 800 patients completed their evaluations and were chosen to be placed on the kidney wait list. 229 received a new kidney, a new chance at a normal life. An alternative to waiting years for a deceased donor is to do what I did. Identify a healthy person close to you that is willing to donate one of their own kidneys. Nationwide, 30% of all kidney transplants are from living donors. In my case, my sister was generous and willing to donate her kidney to me. Our waiting time was just a few weeks. Then comes the surgery, step 5 in the process, putting a new functioning kidney into your abdomen. Kidney transplant surgery has been performed since 1954. At MUSC, between 250 and 300 kidney transplants are performed each and every year. This expertise results in surgeries that have a very low rate of complications. 85% of patients are discharged from the hospital within 3 days. And if your surgery goes as planned and your new kidney is working, you can expect to stay in Charleston for 1 more week at a local hotel. During this time, you will be closely monitored, looking for signs of infection or organ rejection, making sure that your body accepts the new kidney. This is when the assistance of a caregiver is most essential to ensure that you get to your follow-up appointments and take your medications. Overall, over 90% of the patients only spend 10 days in Charleston for a new kidney transplant. 3 days for the immediate transplant operation and 7 days in a hotel. Only 10% of patients are required to stay in town longer for closer management. For the next few months, you will continue to be monitored and you will continue to need frequent blood work. Much of the monitoring can also be performed locally at the telemedicine office. As time goes on, the testing and monitoring lessens as your new kidney begins to work more smoothly. However, you will need to continue taking your medications to make sure that your body does not reject your new kidney. Taking these medications can mean that you will be more prone to infections and slightly more prone to all types of cancer. But your quality of life should return to what it was like before your dialysis treatments. You can travel without the burden of figuring out where the nearest dialysis center is. The dietary restrictions that you faced during dialysis no longer apply. You'll have much more energy and be able to enjoy a normal life. I had kidney failure. I needed a new kidney, and my sister gifted one of her kidneys for me. Now, I have my life back. I can travel, I can spend time with my family, and not sitting in a dialysis chair. You deserve to feel good. You deserve to have that second chance at life. So please, I encourage you, go through transplantation. Get the paperwork, do the blood work. Ask any and everybody, because somebody out there wants to be a hero. No one's gonna know you need a kidney transplant unless you tell them. So don't feel bad, don't be ashamed, don't feel like you're bothering people. This is a chance to live your life the way that you deserve to. So please, I beg you, go through with kidney transplantation.
I hope you enjoyed this video and it gives you an understanding of our kidney transplant process. We want all patients from South Carolina to consider the option of kidney transplant. If not at MUSC, consider another high-quality transplant center that's near our state borders. Please also note that while receiving a kidney through the transplant process allows you to be free of dialysis, you'll still need to take your kidney medicines for the rest of your life and see your doctor for regular checkups. We've included optional patient testimonials that are available for you to view at the conclusion of this video. These testimonials better describe the realities of post-transplant care. If you have any questions about this video or about the kidney transplant process, please ask your home dialysis center staff or the MUSC staff member that's showing you this video. Thank you again for your time.